Turning to Health Watch this evening, atrial fibrillation is a quivering or irregular heartbeat, which sometimes can feel like a fluttering in the chest. The condition can lead to blood clots, stroke, heart failure, and other heart-related complications.
Shelley Bota tells us one way doctors can manage the condition.
At least 2.7 million Americans are living with atrial fibrillation, or AFib. It can be deadly, but there are procedures out there that can put patients' hearts back into rhythm. Sandra Franzen is enjoying life.
I'm gardening, I'm babysitting grandchildren.
3 years ago, Sandra was extremely fatigued and would wake up from an irregular heartbeat.
I couldn't walk from my bedroom to my kitchen.
She was diagnosed with atrial fibrillation.
When the upper chambers, rather than contracting like this, start fibrillating like this.
Her doctor put her on medications, but Sandra developed significant side effects.
My heart would wake me at 2 in the morning and it's pounding away.
So she went to Dr. Mehta at Aurora BayCare Medical Center.
So rather than her heart pumping effectively like this, her heart was virtually going like this and pumping out very little blood.
Sandra was now a candidate for an Afib ablation.
You literally go into the heart through the veins of the legs and cauterize the abnormal circuits that cause AFib.
Putting the heart back into a normal rhythm.
So once the abnormal circuits are gone, the likelihood of having AFib is decreased.
Sandra's heart function recovered, but a few months later,
I was still tired.
Sandra had developed an atrial flutter.
That's another abnormal heart rhythm, which usually coexists with atrial fibrillation.
Dr. Mehta performed an atrial flutter ablation.
And her heart function recovered again.
I woke up the next day knowing that I'm back.
And she's now doing things she couldn't do before the ablations.
I could walk again, I could dress myself, I could cook.
Signs of atrial fibrillation are heart palpitations, tiredness, fatigue, just not being able to do as much as you used to. If you have these symptoms, you should see a doctor. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Bota, Local 5 News.